Good evening, Mrs. Wortham. This is Shannon Roberts, and I am completing my Portfolio 3 assignment. I have an ideal that I think would benefit nurses, patients, doctors, and even legal aspects of the healthcare industry. My ideal is for nurses to have headsets similar to Bluetooth that you use for phones to have on their heads, and when you go into a patient's room and you do their assessments or you provide care, or if anything's going on, they could maybe even be used in a code situation. They would have one button for record, and so the nurse could say their notes, to speak their notes into the Bluetooth headset, and then when they're done, those notes are time-stamped, and they just send them to another computer or a PC, similar to like sending something via email, and those notes would then be typed up by a program that takes verbal or recorded information and puts it into text. I've tried to search and see if someone's already got an idea like this out on in the industry, or something like this is going to work. I couldn't find anything, so I don't think that I am pirating or taking somebody else's ideal. This ideal just came up from my few years of nursing and just seeing that sometimes when you're really busy and you've got a lot of things going on and you've got several patients that you're having to chart on, and you've got admission after admission and discharges going on, that maybe nurses' notes aren't always up to par. And if I feel like a lot of stuff sometimes gets left off of the nurse's notes because you have to document some things in so many different places. Unfortunately, I work at a hospital where everything's still handwritten documentation. It's not even on a computer yet. And so this will also make nurses' notes more legible. I know lots of times you're not able to write your nurse's notes down as things occur. That's the ideal world. Unfortunately, that doesn't always happen in the hospital. So when a physician comes in to see the patient, he doesn't have those needed nurse's notes with information on how the patient's been doing that morning, if they've had any complaints, if they had to give them pain medicine, if they did give pain medicine, how does the patient respond to that? This system would kind of negate that, and it would also make it where nurses' notes, like I said before, everything would be documented, and we all know that if you don't document it, then you didn't do it, even if you did do it. And when it comes to the point where there may be litigation or a lawsuit, if the nurse's notes aren't complete, and there are things that maybe she or he did for the patient, but they're not in the nurse's notes, or if the times are off and they're not accurate, then that could hurt the case as well. This would have an automatic timestamp, so you would know for a fact that the time that you said that you did something would be accurate. I know that I am very passionate about nursing, love being a nurse, love taking care of patients in the hospital setting. Unfortunately, I only get to do that one day a week, but I cannot stand documentation. So I also think that, of course, the patient would be the one that would benefit the most from this, because it would free up the RN or other nurses' time to spend on actual patient care, being in there with the patient, making sure that they're comfortable, making sure that they have everything that they need, and being on top of them as soon as a problem possibly arises. That is again, this is Shannon Roberts, and this is my Portfolio 3 assignment. Thank you, and have a great day.